Hi, welcome to New Nurse Academy Journey to NCLEX. I'm your host, Tiffany Gibson, your personal educator and clinical instructor, getting you all the tips, tricks, and techniques to get you to passing the NCLEX. Welcome again to the channel, and I really hope that you please review, share, like, and subscribe, and let your other future nursing friends know this is the place to be to get yourself together so you can pass the NCLEX. Today, I want to talk to you about when is the right time to actually take the NCLEX. Well, first and foremost, your eligibility requirements is that you pass an accredited nursing school, that you have your ATT number, which is your school sending over to Pearson VUE and the state your information saying that you are eligible to take the test, that you have fulfilled all necessary requirements, clinical hours, didactic hours, and training needed to sit for the exam. Now remember, the NCLEX is a state board licensing exam. It is required for every LPN, LVN, RN to take this test in order to be licensed to practice for patient care in your state. Now, the LPN, LVN, and RN NCLEX exam does not care where you went to school or even what your degree is, because all associate degree, bachelor's degree, whether you went to a 4-year or a community college student, you still need to take this test in order for you to be licensed as a nurse and in order for you to put those credentials behind your name. RN for registered nurse, LVN, LPN for licensed practical nurse, right? So in order for you to take the test, we need to 1, graduate from an accredited nursing program, 2, get the ATT number, and then 3, contact Pearson VUE, which is the facilitator of the NCLEX, to let them know your date and time and ATT number for you to take the test. Now, once you do all that, you can start preparing. And actually, preparation for the NCLEX exam can start well before graduation. I tell my students that it's never too early to prepare for the NCLEX. And actually, as you're studying for your regular classes and courses, you should be doing some NCLEX questions on the side. I normally typically say between 25 to 50 questions a week while you're in school. You ramp that up to about 50 to 100 questions a day, 5 days a week after graduation. But you should always be reviewing your notes, always going over content. And remember, the NCLEX test is nothing like nursing school tests, nothing at all. Because according to the NCLEX, all your patient scenarios happen in Perfect Hospital USA, where you have all your meds, you have all your equipment, you have all your staffing, the doctor's right beside you, you have all your orders. And so in nursing school, your teacher is writing the test based on what they taught you. So it's very specific to your curriculum. And a lot of those test questions are about recall and recognition, making sure that you understand specific detail and content that was taught to you. The NCLEX is all about safety and adequacy and making sure that you have minimum competency to take care of any patient. The NCLEX doesn't know if you want to be a labor and delivery nurse or a peds nurse. The NCLEX doesn't know if you want to work in the prisons or the ER. And so they don't necessarily focus on very detailed content for the test. What the NCLEX does is give you a variety of patient scenarios along the lifespan from birth to death, from inpatient acute care to community settings, from teaching to evaluation. And it wants to make sure that in all situations you are critically thinking and that you are safe with minimal competency. So by doing lots of questions, which is separate from taking quizzes, finals, and midterms in school, taking specific NCLEX style questions and doing it often is going to get you prepared to take the NCLEX. Repetition is key with this. Repetition is key. Repetition is key. Repetition is key. I'm going to say that one more time. Repetition is key. The more NCLEX type questions you do, the more you get exposed to the type of questions that could be asked of you during the exam, the more you build your confidence, the more you build your competence, the more you get prepared to take the test. So you want to do as many questions as you can leading up to a couple of days right before the test. And when you evaluate your exams and you look at your practice scores and they are well above passing, that's how you know that you're ready to take the NCLEX. Good luck. Don't forget to review, like, and share. Also subscribe to this channel and head over to my website if you would like to work with me one-on-one. Also, I have some specific detailed NCLEX prep that will be sure to help you with getting to pass. Again, I'm Tiffany Gibson. Take care. See you soon.